Hi, my name is Kristen Kilpatrick, and I am a Maryville nurse practitioner student. This is my respiratory and cardiac assessment video. This is Lauren, and we already met each other, and she agreed to be my patient. First, I'm just going to inspect the chest and palpate the chest to make sure there's no nodules of any sort. Her chest seems to be very symmetrical and a good size and shape for her body. I'm also looking at the skin patterns to make sure there's no discoloration of any sort. I'm looking at the back also to see if there's any discoloration. I see some freckles from the sun, and that is a normal finding. I'm also looking at her breathing. I would not tell my patient that I'm looking at the respirations in an assessment because I don't want it to be skewed. I don't want them to start breathing fast or anything, but she has a normal rate and depth of respirations. She has no distress of any sort. I'm also looking at the anterior-posterior diameter compared to the lateral, and the anterior-posterior is about half of what the lateral diameter is, and that is normal. I'm also feeling for any crepitus. Which would always be a pathologic finding, and I do not find any crepitus at this point. Next, I'm also looking at the prominence of the ribs, and I don't see any protruding ribs. I'm also looking at venous patterns, and I don't see any abnormal patterns there. Next, I am going to go ahead and feel for the trachea, making sure it's midline, and it is. And I'm also make sure it goes all the way down to the suprasternal notch, which is right here. And the angle of Louis is right here. And the costal angle would be down here. I'm going to go ahead and stand up, turn around. I'm going to find for C7 and T1, which is right here. Next, I'm going to go down to the 10th rib, be right here. Go ahead and take a big, deep breath in. All right, and that was testing for thoracic expansion, and my thumbs rose symmetrically, and that means that's an expected finding. That means that there's no abnormalities with her ribs, there's no problems with her lungs that we can see so far. Next, I am going to go ahead and do tactile fremitus. So go ahead and say 99 every time I touch the back of your chest. 99, 99, 99. 99, 99. All right, and I felt the vibration symmetrically on both sides, which is a normal finding. I'm going to do diaphragmatic excursion next. And Lauren, go ahead and take a big deep breath in and hold it. All right, let it out. And I'm seeing when it goes from resonance to dullness. Okay, I'm going to do the same thing on the other side. Big deep breath in and hold it. Okay. All right, big deep breath in, exhale, and then hold. Okay, same on the other side, big deep breath in and exhale. And I'm going to go ahead and measure, and it is about 3.5 centimeters, which is normal. Normal is anywhere from 3 to 5 centimeters for diaphragmatic excursion. Next, after I take off all this tape. Alrighty, next I'm going to go ahead and have you sit down. I'm going to go ahead and percuss the lung fields in the front. To make sure it's all resonant. It can be a little obscured over breast tissue though. Although I did, they were all resonant in the areas that I palpated and percussed. Next, I'm going to go ahead and listen to the lung fields. I'm going to listen to the front and the back. Take a deep breath and let it out every time I touch your chest. Alrighty, turn around so I can listen to the back of your chest. Okay, turn right back around. Say 99 when I touch your chest.
99, 99, 99, 99, 99, 99.
All right, so when I listened to the chest, I did not hear any abnormal breath sounds. They were clear in all fields. I did not hear any wheezes or anything of that sort. She does not have any stridor that I can hear. I did the vocal resonance, and the sounds 99 were muffled in all of the fields, which is a negative bronchophony. Next, I'm going to do the assessment of the heart. Go ahead and sit down. Okay, first I am going to look at the chest. I'm going to go ahead and percussize the chest. You would get a chest x-ray normally, but if you don't have the equipment to get a chest x-ray, then you can do this. Go from the axilla inward. And I would percuss all the way down, and I would go ahead and mark it, but she has a shirt on. And since she is a woman, I would normally do this assessment without clothing on, but not for this video. Next, I'm going to have you lean forward a little bit. I'm going to feel for the apical impulse, fifth intercostal space at the midclavicular line. I'm going to feel for the carotid pulse at the same time. And they should beat at the same time, beat together for the S1. Next, I am going to go ahead and listen. I'm going to first have her listen in the sitting position, then in the supine position, and then in the left lateral recumbent position. I'm going to listen in all 5 areas. Go ahead and lean forward just a little bit. Aortic, pulmonic, Erb's point or second pulmonic, tricuspid, and mitral. All right, go ahead and lay down. And so far, I did not hear any obscure beats. I just heard S1 and S2. I did not hear any S3, S4 snaps, clicks, any pericardial rubs, or murmurs of any sort. All right, go ahead and lay on your left. All right, you can go ahead and sit up. Okay, and I also did not hear any abnormal beats when she was laying down on her left side and supine. If I did hear a murmur, I would assess it for all of the different characteristics, all 9. Intensity, duration, location, variation of any sort, radiation, pattern, quality, that sort of thing. And thank you for watching my video.